Hello, today we're with Dr. Ayşem and she's ready to answer your questions. Hello, how are you?
Hello, fine, thanks. And you?
Fine, thank you. A lot of people come in to ask for teeth whitening. Can you tell some words about it, how the treatment is going, for how long does it last, for how long our patients should to stay at our clinic to have teeth whitening?
Okay, of course. During whitening, we are applying some gel on your teeth. Of course, we are starting with cleaning first. After cleaning, we are applying the gel, and patients should wait under the blue light for 40 or 50 minutes. It's up to the patient, of course. We are looking at the sensitivity. If sensitivity is okay, we are applying it for 40 or 50 minutes. Its effect depends, of course. If patient is consuming too much coffee or too much colorful drinks, its effect will last for a shorter time. But if patient is careful with using it, if a patient is not consuming too much colorful foods, colorful drinks, of course its effect will last longer. Its effect mostly is seen in first 2 months. After that, it's starting to get reversed, and in 6 months, of course, you will have your same tooth color again.
Okay, and how many times a year patient can make teeth whitening?
Once a year is enough. Once a year is enough. Of course, you can support it with home-type whitening gels, but you shouldn't use too much whitening toothpaste. It will be dangerous for the teeth. For enamel layer, it's important. Once a year whitening is enough.
Okay, thank you. Also, people who want like more constant solution, they're going for bonding, as I understand. Can you tell something about bonding? How is it going?
Yes. For definite colors, for a long-term solution, bonding is an option too, but it has really specific conditions. For bonding, we are not advising it too much because it's too gentle. You should always be careful while you are using bonding. You should be careful about hard foods. You should be careful about parafunction, and it's too gentle. If you bite hard foods or if you have bruxism, it will chip and you will have aesthetic problems about it. But of course, we can apply it with right biting patients. If when you bite, if your closure is okay, we can apply it. And if you are careful, if patient is okay with using it carefully, we can apply it. Its molding is, we are putting resin-based composite on the tooth surfaces. And we have aesthetic solutions, especially in mild diastemas, and if we want simple corrections on the tooth, of course we have really aesthetic solutions with bonding.
Okay. As I understand, bonding is not suitable for everyone.
Yes.
For example, if the person has incorrect bite or the teeth are not too straight, what should be done? What treatment should they?
Yes, of course. If they are too crowded, we can't apply bonding too. If whitening is not all right, and if teeth are too crowding, we are advising crowns, of course, zirconium or porcelain crowns. For aesthetic solutions, of course, zirconium is better. We are applying metal supported veneers or porcelains. If we have too big gaps, or if we don't want to have any aesthetic problems, yes, of course, we can go with metal supported porcelains, of course, but today every people wants zirconium crowns and they are strong enough too, and we have better aesthetic solutions, better aesthetic outcomes, so we are choosing zirconium crowns, of course, generally.
Okay, for applying zirconium crowns, how many days person needs to stay here, and how many times should he or she come to our clinic?
It's up to the tooth number, of course. If we have too much teeth to be shaved and to apply zirconium, we may need 5 or 6 days. If it is just for a couple of teeth, like 2 or 3 teeth, 4 or 5, of course, 2 or 3 days will be enough for us. Of course, after shaving, every patient should have temporaries. The teeth shouldn't left behind after shaving. With temporaries, everybody is comfortable, and after a couple of days, they can have their zirconium crowns, of course.
Okay, thank you. Also, a lot of people come in for us to have their implants done. For example, we're applying all-on-4 or all-on-6 techniques. Can you tell some words about that as well? Because you are a surgeon. Like,
Of course, I can. In full mouth dental implants, they are different, of course. For a couple of dental implants, procedure is not too complex. We are applying dental implant. Generally, we don't need any temporaries to you, and after waiting period like 3 or 4 months, we are applying the crowns. But for full mouth, it's a little bit complex. Sometimes we may need sinus surgery, sometimes we may need bone graft first, sometimes we need to take block graft first and then apply it. We can't apply dental implants every time in the first session. Sometimes we are going with grafts or sinus surgery first and wait for 6 months and then apply dental implants, wait for 4 months and then the crowns. So generally procedure takes 4 months. In the first visit, we are applying dental implants, we are preparing the temporaries. For temporaries, we are generally going with the removable ones. But of course, if we can, we are going with fixed temporaries too. After 4 months, we are going with the final crowns. For that, we need at least 2 weeks. In dental implant session, it's not that important. 3 or 4 days are enough for us. But for the crowns, of course, the 2 weeks will be needed.
Yes, sure. Also, a lot of people come in to Marmaris like on holiday. Is it possible to have treatment while they are on holiday?
Yes, we are usually doing these procedures during they are having holidays. Of course, it's possible. It's not too painful. Just if we go with full mouth extractions and full mouth dental implant at the same time, it can be tiring because having dinner, having meals will be a problem. But in 3 or 4 days, you will have your temporaries. So if we go with full extractions and full dental implants, we are choosing last days of the holiday. For the other procedure, they're not affecting because after shaving, we have our temporaries, or after bonding, it's just 1-day procedure. It's not painful, or cleaning or whitening and whitening. It's just sensation. It's not affecting the holiday too much.
Like for every treatment, normally like 6-7 days is needed, like at least.
And people are coming for at least 6
just or 7 hours the rest. Yes, sure. And some people are scared of the dentist.
Yeah.
They should be scared.
Yes. Like you. Yes, most people are scared of dentists. We know that. Nobody likes us. We know that too. But I think it's about talking. When we talk each other, when we explain every step, patients are getting calmer. We are like that too.
Yes.
When I sit at table, even if I have simple cleaning, I'm always nervous about it. But when I have a deep breath and when I talk to my doctor, it's okay. I know everybody is nervous, but you should accept your condition first.
Sure.
And then take a deep breath, and then everything will be all right. Today, with gentle anesthesia techniques, nothing is too much painful, so it's not that scary.
Okay,
Not
thank
like
you.
a test.
Yes, thank you very much for answering our questions.
You're welcome.
Hope to see you next time.
Hope to see you too. Bye bye.
Yes, bye bye.